Thank you. Thanks to the AIOS for giving me this opportunity. Audio also I need. So, yeah. Right. So in proliferative diabetic retinopathy, one should remember that the neovascularization breaks through the vitreoretinal interface and proliferates on it using it as a scaffold. But you should remember there is frequently anomalous separation because of the vitroschisis, and the outer layer is the secondary membrane. So a lot of times when you're dissecting, we don't realize that there is already, it is an incomplete PVD which is existent, so we need to detect this secondary membrane. And what you generally see is the inner layer. So you need to identify, just to show you how it would look. So what you would be seeing clinically or very apparent is the white paper that you see, but behind it there is a thin plastic sheet. So using a method, basically just to tell you how you could use a method to detect this cleavage plane, I'm just using a needle just to show you that when you start approaching it, what is obvious, you never realize that there is a secondary layer that is present. And by dissecting from the secondary layer, you're able to dissect the membrane. So this is just to show you how would be the real situation when you come to a diabetic membrane. So how do you design this pick? This is a hypodermic needle. I think there's voice if you could, which is just pressed against a metal plate. You would get a fine, bend at its tip. This is enough for you to detect the secondary membrane. You have the audio, please. No? Okay. There's an audio, but anyway, so it's okay. So please continue. Continue. I'll give the audio, yeah. Don't worry. Go back. नहीं यार. Play कहाँ क्या हो गया? हाँ. No, leave this. Huh? So this is how you would find that, you start using the cutter, like what everyone starts, you find that the cutter is a very good dissecting tool. But when you start failing to, remove this membrane because it's very adherent, that is the question that Dr. Ajit put up. Best is to now use the pick. You see that there is a membrane which is extending far beyond. This is the true cleavage plane. So you identify this. You can use any of the instruments to help you in your dissection. So this is just to show you that when you reach a stage wherein further dissection is difficult, you just identify this cleavage plane. It comes out much more easier. So one elegant tool to help you in your dissection. And then you can use the cutter to clear that. So this is one easier method for you in your dissection. Now, how do you detect it? I've just shown you some of these. Now, in this situation, when you see everything very adherent, there are secondary membranes. So use the pick. You will find that it starts dissecting much easier. Everything is very gentle. There is not much undue traction on the membrane because this does not allow you to produce so much of traction. So you just need to dissect. This is the actual cleavage plane. So now once you know the actual cleavage plane, surgery is a lot easier. So this is all just to step up to show you what are the initial steps that you could adopt to help you to identify the cleavage plane, because I know everyone keeps talking about it. So this is another tissue. You know that any further dissection is difficult. Actually, I'm just using a spatula in this just to help you understand that you just need to understand this cleavage plane, which is, extends beyond that what is apparent, clinically apparent. And once you do this, this membrane starts coming out very easily. So whenever you have a situation wherein further surgery is not possible, you know that there is a secondary membrane. It's important because the entire surgery becomes a lot easier. See, this is how I first identify it. I know that there is a secondary membrane here. I use a pick, first identify the secondary membrane. It does not injure the retina. It's a very safe tool because it just produces a gentle scratch. It is much finer than the bent MER blade. Actually, it's a 26, I use a 25 gauge system. So this is a 26 1.5 inch needle. So it's very, very fine. Once I've identified, I know that where the secondary membrane is, I continue further. you see that this is a lot easier. I also am a great fan of
just blood dissection, and you just have to cut those small points of attachment that is present between the fibrovascular tissue and the retina. Here I am using the scissors to help in the dissection, but you would see a majority of work is generally with blood dissection.
So these are all very easy ways for what you can understand how you could.
Example of a large fibrovascular proliferation very close to the macula, causing traction on the macula. And once you've identified the secondary membrane, here the secondary membrane is seen to extend over the disc and beyond. And once we identify that, the membrane dissects a lot easily. Once you have done this dissection, then you
1 minute.
use any of the instruments.
Yeah, I finished. I think there's not much of. No, these are all just to show you the concept. Then you can use the scissors or to cut off the fibrovascular tissue. So mine was just to, because there are so many presentations on diabetic vitrectomy, I think I just wanted to show some small step that you could adopt when you do diabetic vitrectomy. And this is when you complete the surgery. So makes it a lot easier.
Thank you.
Excellent.
You can conclude.
No, it'll just take a minute just to show you how easy it is. This
it
is
is time
entirely
is
with the pick.
Hemanth, time is up.
Thank you, sir.
You are not able to progress in the membrane dissection any further. Look out for the secondary.
Let the video run. I have one or two questions that these membranes you are seeing now while dissecting, you have a continuous membrane with multiple attachments. There is intervening areas are there and you are trying to remove the whole membrane toto. Certain times what will happen is you concentrate on one area and the other area it's giving away. Actually you have seen nitrogen break formation.
Correct.
So these cases, what would you suggest? You should segment and proceed?
We
or you
segment.
should
I generally do segment. So it's not that it's going to be, see, one need not remove it all in let's say, en bloc, as one would say, that is quite gone. We actually divide them.
Yes.
It's a lot more easier
Certain
dividing
times
it.
you should not think about en bloc dissection. Certain times it's better to segment so that iatrogenic breaks should not happen.
Would not occur.
Thank you very much. And now